Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear GP talking to a patient called Mrs. Turner. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Turner, come in, please. How are you feeling today?
Hi, Doctor. I'm not great, to be honest. I've been having this terrible pain in my stomach for a while now, and it just doesn't seem to go away. It's starting to really worry me.
I'm sorry to hear that. Let's go over your symptoms in detail. When did the pain start, and what does it feel like?
It's been a few weeks now. The pain comes and goes, but it's mostly this dull, gnawing feeling right in the middle of my abdomen. Sometimes it gets really sharp, especially after I eat or if I haven't eaten in a while. I've tried taking antacids, and they help for a little while, but the pain always comes back.
That sounds like it could be a peptic ulcer. Peptic ulcers are sores that develop in the lining of the stomach or the upper part of the small intestine. The fact that the pain worsens after eating or when your stomach is empty is quite typical of this condition. Do you feel any nausea, bloating, or notice a burning sensation?
Yes, exactly. I feel bloated most of the time, and there's this constant burning feeling in my stomach. Sometimes I even feel a bit nauseous, but I haven't actually thrown up. It's just this lingering discomfort.
Those are all common symptoms of a peptic ulcer. They're usually caused by an infection with a bacterium called Helicobacter pylori, or from the long-term use of non-steroidal anti-inflammatory drugs NSAIDs like ibuprofen, or aspirin. Have you been taking any of these medications frequently?
I have been taking ibuprofen more than usual for my back pain, actually. Could that really be causing this?
Yes, NSAIDs can damage the protective lining of the stomach and lead to the formation of ulcers. When the lining is weakened, stomach acid can irritate the tissue underneath, causing pain and discomfort. But don't worry, peptic ulcers are treatable. We'll run a few tests to confirm the diagnosis and identify the underlying cause. If it's related to Helicobacter pylori, we can treat the infection, and if it's due to NSAIDs, we can adjust your medications to prevent further irritation.
That's a relief to hear. What kind of tests do I need to take?
We'll start with a breath test or a stool test to check for Helicobacter pylori. If needed, we might also recommend an endoscopy, which allows us to look directly into your stomach and see the ulcer. It's a simple procedure where a thin tube with a camera is passed through your mouth into your stomach while you're sedated, so it's not painful.
An endoscopy sounds a bit intimidating, but I guess it's important to know what's going on.
I understand it might sound uncomfortable, but it's actually quite routine, and the results will help us determine the best treatment. Once we have a clear diagnosis, we can tailor your treatment plan. In most cases, we'll prescribe medications to reduce stomach acid and, if necessary, antibiotics to clear up any infection.
How long would the treatment take? Will I have to change my diet too?
Treatment usually lasts a few weeks, depending on the severity of the ulcer. will prescribe proton pump inhibitors PPIs or H2 blockers, which reduce the amount of acid your stomach produces, giving the ulcer a chance to heal. If Helicobacter pylori is the cause, a course of antibiotics will be included as well. As for your diet, we'll recommend some changes to help manage your symptoms and prevent further irritation. Avoiding spicy foods, alcohol, caffeine, and acidic foods like tomatoes or citrus can reduce discomfort while your stomach heals.
I've already cut back on spicy foods, but I didn't know things like caffeine could make it worse. I guess I'll have to say goodbye to my morning coffee for a while.
Yes, unfortunately, caffeine can increase stomach acid production and worsen symptoms, but it's just temporary while we work on healing the ulcer. You might also want to avoid smoking if you do, as it can slow down the healing process.
I don't smoke, luckily. But what happens if the ulcer doesn't heal? Are there complications I should be worried about?
Most peptic ulcers heal with a proper treatment, but if left untreated, there can be complications. These include bleeding, which can occur if the ulcer erodes a blood vessel or perforation, where the ulcer creates a hole in the stomach or intestinal wall. Another possible complication is gastric outlet obstruction, which can happen if the ulcer blocks food from passing through the digestive tract. However, these complications are rare, especially if we catch it early and treat it properly.
Extract 2, questions 13 to 24. You hear a neurologist talking to a patient called Clara. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Clara. I'm Dr. Malik, and I'm here to talk about the issue you've been dealing with, head lice. How are you feeling today?
Oh, I'm fine, but honestly, I feel a bit embarrassed. I can't believe I'm here because of lice. I thought this was something only kids got.
It's actually quite common for adults to get head lice, especially if you've been around children recently. There's absolutely no need to feel embarrassed about it. It's more widespread than people realize. When did you first notice the itching or discomfort?
A few days ago, maybe 3 or 4. At first, I thought it was just my scalp being dry, but then the itching got worse and I couldn't stop scratching. My sister helped me check, and that's when we found the lice.
That sounds pretty typical. It usually starts with mild itching, but the constant scratching is a telltale sign. I see here you've tried over-the-counter shampoos. Have they helped at all?
Not really. I mean, I followed all the instructions, but the itching hasn't gone away, and I think I can still feel something crawling. I don't know if it's just in my head, though.
It can definitely feel that way. Lice are resilient creatures. Even after using lice-killing treatments, sometimes they can persist if some eggs or nits are left behind. The nits are usually attached to the hair near the scalp and can be harder to remove, even after treatment.
That's exactly what I'm worried about. I mean, I've washed my hair a few times, but I don't know if I'm getting rid of all of them. Is there anything else I can do?
Yes, there are a few things. First, you'll want to use a fine-tooth lice comb to physically remove both lice and nits after using the shampoo. It's best to do this on wet hair because the water makes the lice less active and easier to catch. Comb carefully through small sections of your hair, starting from the scalp and working down to the ends.
I've heard about that, but it sounds so tedious. How often should I be combing?
It is tedious, but it's necessary to ensure you remove as many lice and eggs as possible. You'll want to comb daily or every other day for at least 2 weeks, even if you don't see any live lice. The idea is to break the life cycle of the lice, which means catching any new lice that might hatch from missed nits.
Okay, so shampoo and combing. Is there anything else I need to do at home? I've heard that lice can live on bedding and clothes.
Good question. While lice cannot survive long off the human scalp, usually no more than 24 to 48 hours, it's still important to clean items that have been in contact with your head. That means washing bedding, hats, and scarves in hot water and drying them on high heat. Vacuuming sofas and car seats is also a good idea. And don't forget about hairbrushes and combs, soak them in hot water for at least 10 minutes.
That's a lot to think about. Should I also be worried about my family getting lice?
Lice spread through close head-to-head contact, so it's possible for others in the household to get them. I recommend that your family members check their hair for any signs of lice or itching. If anyone has them, they'll need to follow the same treatment plan. Avoid sharing items like brushes, hats, or towels for now, just to be safe.
I see. What about my work? I don't want people to know about this, but I also don't want to spread it.
I understand your concern. You can go back to work as soon as you've started treatment. Head lice aren't a reason to stay home, but you should avoid close contact with others until you've successfully gotten rid of the lice. Most people won't even notice if you're careful.
That's good to know. Is there any chance I'll have to deal with this again? I'm really hoping this is a one-time thing.
Lice can come back, but the key is being vigilant with follow-up treatments and household cleaning. It's also helpful to avoid sharing personal items, and if you're around children often, just check your scalp regularly. There's no way to guarantee you'll never get them again, but with the right precautions, you can significantly reduce the risk.
Okay, that makes sense. It's just so frustrating. I didn't even know how easy it was to get lice as an adult.
Many people think lice only affect children, but adults can get them just as easily. It's more about being in close proximity to someone who already has lice, regardless of age. The important thing is that lice are not a sign of poor hygiene or anything like that. They simply move from one person's hair to another through direct contact.
I'm definitely learning a lot. One last question. If the treatments I've used aren't working, what's the next step?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 medical professionals discussing each other. Now read the question.
So, what did you think about the training on patient confidentiality, the one from last Thursday?
I thought it was useful, especially the part about the legal updates. With confidentiality laws being updated regularly, it's good to stay informed. I found that section really helpful.
Yeah, definitely. What about the guidelines on how to handle patient records properly?
Well, that was quite straightforward for me, but I think it could have been valuable for those who are less familiar with the procedures. It's basic, but necessary for some.
I hadn't considered that, but you're right.
Now look at question 26. You hear a doctor explaining the ethics of organ transplant allocation to a group of medical students. Now read the question.
Organs.
That's an excellent question. Organ allocation is based on several criteria. The most critical factor is medical urgency, which means patients who are in the most immediate need are prioritized. However, other factors come into play, such as the likelihood of success, blood type compatibility, and time spent on the waiting list. In some cases, living donors may step in, which opens up other considerations. It's a delicate process, but the goal is always to save as many lives as possible while remaining fair.
So, medical urgency is the top priority, but other factors like compatibility and waiting time are considered too?
Yes, exactly. And keep in mind that cultural perspectives on organ donation can also influence the process. though the core of the decision-making always revolves around fairness and medical criteria. Great. Any other questions?
Now look at question 27. You hear a discussion with Dr. Smith. Now read the question. Good morning, team. Today, we'll focus on recent medical errors in the ward and the legal implications that follow. Dr. Smith, could you start us off with an update?
Sure. Last week, there was a case involving a medication error. A patient was administered the wrong dosage of an anticoagulant, which led to prolonged bleeding. Fortunately, the patient recovered, but it raised questions about the process of double-checking medication doses. We've documented the incident and will follow up with a review of our current safety protocols.
That's a serious issue. Have legal actions been initiated against the hospital or the staff involved?
Not yet. The patient and their family have been informed, and we're currently managing it through the hospital's internal review system. However, we are also focusing on how this can be used as a learning opportunity to prevent future errors.
That's a critical step. It's essential to not only address the legal responsibilities, but also emphasize continuous education and procedural improvements to avoid recurrences. Now look at question 28. You hear a doctor explaining about a patient. Now read the question.
So, we have a 58-year-old patient with a history of chronic steroid use for autoimmune disease who was admitted last night. The patient presents with a high-grade fever, productive cough, and shortness of breath. On physical examination, there were decreased breath sounds and crackles over the left lower lobe. The initial chest X-ray shows consolidation in the left lower lung field, raising concerns for pneumonia. Given the patient's immunocompromised status, we need to be vigilant for atypical organisms, and will need to send sputum samples for bacterial, fungal, and viral cultures. Empiric broad-spectrum antibiotic therapy, covering both typical and atypical organisms, should be started immediately. Additionally, we should get a complete blood count, basic metabolic panel, and blood cultures to rule out bacteremia.
Now look at question 29. You hear part of a conversation between a trainee doctor and a senior doctor. Now read the question.
I have a few questions about how to interpret this CBC report. I can see the hemoglobin level is within the normal range, but I'm not sure about the other values.
Let's take a look at the key components. A complete blood count measures several parameters. So, what's the first component you should look at?
Oh, that would be the white blood cell count, which can indicate infection or inflammation.
Exactly. And what comes after that?
Next, you check the hemoglobin and hematocrit levels to evaluate for anemia.
And what about platelets?
Platelets are important for clotting, and low levels can indicate thrombocytopenia.
So, do you notice any abnormalities in these values?
Well, no, everything seems within the normal range, but I still feel uncertain.
Now look at question 30. You hear a nurse explaining digitizing patient information management. Now read the question.
Hospital has been gradually shifting towards digitizing our patient information management. Starting next month, we will officially transition to using an electronic health records AHR system across all departments. This new system will help streamline access to patient information, ensuring that we can retrieve and update records in real time, which should improve the efficiency of care delivery. The EHR system will also offer features such as alerts for potential medication errors and the ability to track patient progress more accurately. This transition, however, will require some adjustments on our part as we get accustomed to the new technology. Any concerns or issues with the system should be reported to Jason from the IT support team.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah Martinez, expert on genetic testing. You now have 90 seconds to read questions.
Hello and welcome to Health Research Roundup. Today, we're talking about the rapidly expanding field of genetic testing and how it's revolutionizing personalized medicine. Genetic testing is helping doctors tailor treatments to individual patients based on their unique genetic makeup. Joining us today is Dr. Sarah Martinez from Stanford University Medical Center, who has been at the forefront of this research. Dr. Martinez, thank you for being here.
Thank you for having me.
Let's start by asking a basic question. Why is genetic testing so important for personalized medicine?
Well, genetic testing is important because it allows doctors to understand a patient's genetic profile and use that information to predict how they'll respond to certain treatments. For example, some people metabolize medications differently, so what works for one patient might not work for another. By analyzing a person's DNA, we can identify these differences and select the treatment that is most likely to be effective for them, which can significantly improve patient outcomes.
So instead of a one-size-fits-all approach, you're saying this allows for more individualized treatment plans?
Exactly. In traditional medicine, treatments are often developed based on averages, what works for most people. But as we know, everyone is different. Personalized medicine through genetic testing helps us move away from that model and provides treatments that are specific to the individual. We're seeing this applied more and more, especially in fields like oncology, where certain cancer therapies are now being matched to the genetic mutations present in a patient's tumor.
That's fascinating. How long has genetic testing been used in this way? Is it a relatively new development in medicine?
In a way, yes. Genetic testing has been around for decades, but it's only in recent years that we've had the technology and the understanding of genetics to apply it effectively in personalized medicine.
Initially, it was mostly used for diagnosing rare genetic disorders. Now, with advances in genome sequencing and a better understanding of the human genome, we're able to use genetic information to guide treatment decisions for more common conditions, like cancer, heart disease, and even mental health disorders.
That brings up an interesting point. How is genetic testing impacting the treatment of diseases like cancer?
It's having a huge impact. One of the most significant breakthroughs is in the field of oncology. For example, certain types of breast cancer, like those with the BRCA1 or BRCA2 mutations, respond better to specific therapies. We can use genetic testing to determine whether a patient has these mutations, and then prescribe the treatment that's most likely to work. The same is true for other cancers, like lung or colon cancer, where specific gene mutations influence how well patients will respond to targeted therapies.
Are there any downsides to using genetic testing in healthcare, though? It sounds like a perfect solution, but I imagine there are some challenges.
You're absolutely right. There are definitely challenges. One of the biggest issues is cost. Genetic testing can be expensive, and not all healthcare systems or insurance providers are willing to cover it, especially if it's not deemed absolutely necessary. Another issue is privacy. People are understandably concerned about how their genetic information will be used, and who will have access to it. There are also ethical concerns about what people do with the information once they have it. For example, if a genetic test reveals that someone has a high risk of developing a particular disease, what does that mean for their insurance coverage or employment opportunities?
That's an important issue. Are there regulations in place to protect patients' genetic information?
Yes, in many countries there are laws that protect the privacy of genetic information. In the United States, for example, the Genetic Information Non-Discrimination Act, GINA, prevents health insurers and employers from discriminating based on genetic information. But even with these protections, there's still a lot of debate about how genetic data should be handled, especially as testing becomes more widespread.
It sounds like there's a lot to consider. Beyond cancer treatment, are there other areas of medicine where genetic testing is making a big difference?
Yes, we're seeing it used in a number of areas. Cardiovascular medicine is one example. There are certain genetic variants that can increase a person's risk of heart disease or stroke, and we can use that information to tailor prevention and treatment plans. It's also being used in psychiatry, where we're beginning to understand that certain genetic markers can predict how patients will respond to medications for depression or anxiety. The potential applications are really broad, and we're only scratching the surface.
That's amazing. Given how promising this field is, do you think genetic testing will become a routine part of healthcare in the near future?
I think it's inevitable. As the technology becomes more affordable and accessible, and as we continue to understand more about how our genes influence our health, genetic testing will likely become a routine part of healthcare. We'll be able to screen for a wide range of conditions and make more informed treatment decisions. It's really exciting to think about where this could lead in the next decade.
Exciting indeed. Before we wrap up, is there anything else you think people should know about genetic testing and personalized medicine?
I would just say that while genetic testing is a powerful tool, it's not a silver bullet. It's one piece of the puzzle in understanding a person's health. Lifestyle factors, environmental influences, and other elements still play a significant role. But genetic testing gives us an incredible window into what makes each of us unique and allows us to take a more personalized approach to treatment. Extract 2. Questions 37 to 42. You hear Dr. Adam Reynolds talking about self-diagnosis using online health information. Now, read the questions. You now have 90 seconds to read questions.
I'm Dr. Adam Reynolds, a general practitioner. And today I'd like to talk about something that's becoming increasingly common but also increasingly problematic: self-diagnosis using online health information. It's no surprise that people turn to the internet when they feel unwell, with so much health information readily available online. It's tempting to type a few symptoms into a search engine and come up with a diagnosis yourself. However, this trend is leading to significant risks, both in terms of misdiagnosis and inappropriate treatment choices. Now, I'm not saying that accessing health information online is entirely a bad thing. In fact, reliable websites and patient information portals can be valuable educational tools when used appropriately. The issue arises when patients try to diagnose and treat themselves without proper medical guidance. Many symptoms are nonspecific and can be linked to various conditions, some of which are minor, but others can be life-threatening. Unfortunately, online platforms often provide general advice that fails to take into account individual patient histories or the nuances of symptom presentation. Take, for example, a patient I recently treated. We'll call her Lucy. Lucy was in her late 22nd and had been experiencing persistent headaches and fatigue for about a month. Instead of seeing a doctor, she decided to search for her symptoms online. Based on what she read, Lucy believed she was suffering from chronic migraines. She followed advice she found on an internet forum and started taking over-the-counter painkillers every day. Not only did this fail to address her underlying issue, but it also led to medication overuse headaches, a condition that worsened her overall health. When Lucy eventually came to see me, it was clear that her symptoms were actually due to an underlying thyroid issue, which had gone undiagnosed because she delayed seeking professional care. Had she consulted a healthcare provider earlier, the problem could have been detected and managed much sooner, sparing her the additional complications she experienced. This case is just one of many I've seen in recent years where patients have relied on incomplete or misleading online health information, with potentially serious consequences. Another problem with self-diagnosing online is the tendency for people to jump to worst-case scenarios. The internet is full of anecdotal stories and unverified medical advice, which can be misleading and fuel anxiety. For instance, people might experience mild chest pain and immediately assume they're having a heart attack based on what they've read online, when in reality the pain might be due to something far less severe, such as acid reflux. The issue here isn't just unnecessary worry, but also that focusing on the wrong diagnosis can delay appropriate care for the actual condition. On the other hand, some people may downplay serious symptoms because they've read accounts online of people with similar symptoms who turned out to have minor ailments. This can result in life-threatening conditions going undiagnosed or untreated. The internet doesn't have the ability to differentiate between symptoms that may look alike but stem from very different causes. This is why it's crucial for people to consult a healthcare provider who can assess their full medical history, conduct physical exams, and, if necessary, order diagnostic tests to reach a precise diagnosis. I've also seen cases where people misuse health apps or symptom checkers. These apps can be helpful tools for gathering information, but they are not substitutes for professional medical evaluations. The algorithms used in these apps are based on probabilities and cannot account for the complexities of individual cases. It's common for people to receive several possible diagnoses through these tools, leaving them confused and unsure of how to proceed. To illustrate the dangers of relying solely on online information, let me share another case. A man in his 40s, let's call him John, had been feeling shortness of breath for a couple of weeks. After consulting an online symptom checker, he convinced himself that it was due to anxiety. He followed some breathing exercises he found online, but ignored the advice to see a doctor. When John finally came to my clinic, his condition had worsened, and after running some tests, we discovered he had early-stage heart failure. By delaying proper treatment, John had put himself at greater risk. Had he come in sooner, we could have managed his condition more effectively before it progressed. The moral of the story here is that while online resources can sometimes provide helpful general information, they should never replace a visit to a healthcare professional. Doctors are trained to consider the whole picture, which includes not just your symptoms, but also your medical history, lifestyle, and any risk factors you might have. Self-diagnosing can lead to inappropriate treatments, delay in necessary care, or even the worsening of an existing condition. So, my advice to anyone feeling unwell or uncertain about their symptoms is simple: don't rely on the internet for diagnosis. Instead, consult a healthcare professional who can provide accurate advice, a proper diagnosis, and a treatment plan tailored to your specific needs. Let the internet be a tool for learning, not diagnosing.
That is the end of Part C. You now have 2 minutes to check your answers.